Hello and a very warm welcome to the first episode of Men.Health.Talk, brought to you by HCL Healthcare. I'm Shikha Saxena, President of HCL Healthcare. I'm truly delighted to have you all with us for this important and insightful conversation. And as your host, I will make sure that you keep smiling through the show. Today, we are bringing together some of the finest minds in healthcare to talk about a topic that deserves more attention than it truly gets, which is men's health. Our very special guest of honor today is one of India's most respected and decorated doctor. He has been bestowed with Padma Bhushan and many other coveted awards. His work has truly redefined diabetes and endocrine care in India. And today, we are honored to have with us the Group Chairman of Endocrinology and Diabetes at Max Healthcare, Dr. Ambrish Mittal. Along with him, we have Mr. Tarun Thakur, the Senior Vice President, Operations and Delivery at HCL Healthcare. Tarun's vision and leadership continues to shape innovative and accessible healthcare delivery across the country. We also have with us Dr. Amit Kumar Gupta, the Senior Medical Director, Medical Excellence at HCL Healthcare, whose expertise and commitment drive our mission of quality, evidence-based, patient-centric care. And last but not the least, Dr. Gautam Lakshman Medhi, Director, Care Plans at HCL Healthcare, a key architect in designing integrated care programs that touch lives every single day. Today, together we'll explore the many dimensions of men's health: physical, emotional, preventive, and behavioral. Thank you all for being here today. And let's start it from the top. Dr. Ambrish, we often talk about lifestyle diseases, but India's work culture today, long hours, high stress, minimum breaks, and extremely sedentary routines, isn't helping at all. So how does this typical Indian work culture impact men's physical and emotional well-being?
I think the present way of modern lifestyle, as we call it, the urban lifestyle, is obviously going to have an adverse impact on our health. So, for example, what are the basics of a good lifestyle? The basics of a good lifestyle would be eating a healthy diet, eating on time, moving about regularly, getting adequate hours of sleep,
Right.
and combating your stress in whatever way you think appropriate. Now, if all these are compromised in a typical urban corporate lifestyle, which means that people are working often round the clock, or even if not round the clock, at odd hours, during
Right.
odd hours. So that's also very important.
Sure.
Which time of the day are they working? Unable to eat on time,
Yes.
right? Long commutes and long work hours leave very little time for physical exercise. And of course, stress is a given, it's obvious. I mean, this is the same for doctors. Doctors' lifestyles are the same. Doctors have similar story as people in the executives in the corporate sector. So I think some kind of balance will have to be reached. Otherwise, it's very clear that with all these factors going against us, we are bound to land up with health issues. Whether it's men or women in this case, it doesn't really matter. So I'll give you a small example. People work long hours and then they eat at wrong times and they order food. Or the very big offices like this one presumably have very good cafeterias. But the fact is that very often, what I have seen, including in hospitals by the way, the food that is available to people as a quick ordering food is really not the healthiest.
Right.
So people are working together, all night, and they are munching all night. They even have apps that deliver food at night. Only
Yes.
at night.
Absolutely. Yes.
So I mean, these are obvious things. And while on the one hand, one wants to continue with India going ahead, with companies going ahead, with economic growth and progress, on the other hand, we'll have to balance it out because ultimately there cannot be progress without health.
Right. Right. Some very, very relevant, basic but relevant points. And they say that when you have to correct something, go back to the basics. So, well, some of these points left me thinking that we at HCL Healthcare actually practice before we preach. So, Doctor, I'm completely in agreement with all your points. And before joining HCL Healthcare, my food habits, timings, everything were erratic. But here at HCL Healthcare, this big office, we do have a big cafeteria, but we also have a designated lunch hour. From 1 to 2, you will make sure that everybody is in the cafeteria and having either food which is brought from home or some healthy food that we serve in the cafeteria. And once again, after years of, I would say, bad habits, I've been able to personally come back and inculcate at least a lunch hour in my work schedule. It's really helped. So thank you for bringing those points up.
So I'll make an additional point here.
Yes.
I'm talking of how far ahead some countries are in this. When I was visiting Japan in the early 90s, we had a collaboration with them at that time.
Right.
So several times I visited Japan. So lunch hour was sacred. I mean, you couldn't eat fast. You sort of, everyone ate slowly. It had to be 30 minutes of eating.
Right.
And then talking. So like gulping food while working, like the Americans say, we grab a bite. I think that's the worst phrase one could have.
Absolutely.
So actually mindful eating was practiced by Japanese always.
Yeah.
And
Yes.
in big hospitals, there would be some kind of sound, not like a siren, going off, where every 1 or 2 hours in a meeting, the executive would get up and start stretching his arms and legs and,
Wow, that's wonderful.
And this is 1991. So, I mean, what I'm saying is that these are basics, as you said, but they just have to be implemented, and I'm so glad that you're following that in this office.
Thank you so much. Wonderful thoughts. Moving on to Tarun. Tarun, studies often say men visit doctors only when something is already on fire. What does this say about how we approach chronic lifestyle diseases, and how do we convince men that prevention isn't a conspiracy?